So the site is almost 1,000,000 square feet, and we talk a lot about 1,000,000 square feet of care. I think that's the main, most important piece of this. While the building is bricks and mortar, and that's a wonderful thing, and it's beautiful, and it is state of the art, and it will be one of the best hospitals in Canada for a number of years. I think the most important part is that it's 1,000,000 square feet of care, and bringing into it patient client-centered care, making sure that we are focused on our patients as our main priority. I think that's the number one. I also, though, think that we're bringing new programs to Niagara, and that's a huge step forward for all of Niagarans. So we've always had mental health programs, we've always had cardiac care, and we've always had oncology, but never the extent that we have now. So radiation is brand new for oncology. We've never had it here. Patients have always traveled to Hamilton or beyond. Within the mental health program, we haven't had what we call tertiary mental health programs, which are higher level, more acute for the very seriously ill mental health patients. And in the heart investigation unit, we've never been able to do cardiac catheterizations. So that is a huge step forward. Again, patients have traveled to Hamilton for that service. And what this means for all of the patients is that their families can also be part of their care, much more so, or that they don't have to drive them. Many people don't drive themselves, obviously, but I think having family able to visit more often, to be able to be closer, to be part of the care team is really important, and that's what we're providing for Niagara. It's exciting for the healthcare professionals to work in this environment. Very difficult to work in an environment that was not designed for current standards. And so I think that they're excited to be here. That improves care just by their whole sense of being in this organization, in this facility. And I think that helps. But for patients, 80% of our rooms are private rooms. That will really help with our infection control. Our previous buildings were not designed when infection control, the standards were what they are now. So we are now meeting and exceeding all of the infection control standards, and that's a good thing for our patients and for our staff and physicians. I think for patients, it's an exciting time to be here. No one wants to be in the hospital, but when they are in the hospital, they know that they're in a great state-of-the-art facility with state-of-the-art equipment and everything that they could ask for.